Good afternoon. Thank you for attending this domestic violence workshop. I am Andrea Daniels, the National Silhouette's first vice president, and I am with the National Silhouettes of Kappa Alpha Psi Fraternity Incorporated. I have the distinct pleasure of introducing our speaker today. Dr. Bernadine Waller is an adjunct professor in the School of Social Work at Adelphi University. She is a research fellow at Columbia University, Irving Medical Center, New York State Psychiatric Institute, where she investigates partner violence and mental health while focusing on Black women. She is also a TEDx presenter who gives talks to a wide variety of audiences. So let's talk about some stats on domestic violence and Black women. More than 40% of Black women will experience a domestic violence in their lifetime, according to the Institute of Women's Policy Research Status of Black Women in the United States. In comparison, 31.5% of all women will experience domestic violence. A report from the National Center for Victims of Crime found that 53.8% of Black women had experienced psychological abuse, while 41.2% of Black women had experienced physical abuse. Black women are 2.5 times more likely to be murdered by men than white women are. In 92% of these cases, the Black female victims knew their killers. 50% of these homicides were committed by a current or former intimate partner. Sexual violence affects Black women at high rates. More than 20% of Black women are raped during their lifetimes, a higher share than among women overall, 1 in 5. So now it gives me great pleasure to turn it over to Dr. Bernadine Waller. Thank you.
Thank you so much, Ms. Daniels, for that warm and gracious introduction. You were completely correct. The statistics are stark. So I'm going to actually go right into my presentation. And so thank you for joining me for my presentation, Silent Screams, Intimate Partner Violence in the Black Community. If you have any questions regarding my presentation or anything about my presentation, I want to encourage you to put them in the Q&A. So this gives me an opportunity so that after the presentation, I can absolutely positively answer as many questions as I can. I want you to know that this presentation today is really all about you. That said, that I want to warn you that some of the content in my presentation today may be triggering. So I want to give you the permission that you need to feel the full breadth and depth of your emotions, and to encourage you to pace yourself so that if you need to turn the audio down at any point in this presentation, if you need to walk away, or if you're listening to the recording, if you need to pause and come back or even stop listening, please feel free to do that, because my central focus is your mental health and well-being. That said, that if you do need a mental health professional, I want to encourage you to see one in your area, someone in your community who you feel comfortable with. I also want to foreground my presentation by providing you with the domestic violence helpline, which is noted on your screen. And that number is 1-800-799-SAFE. That's 1-800-799-7233. Now, as we begin to settle in on today's presentation, I want to pose a question to you that may seem a bit controversial. Is it really domestic violence? Commonly, domestic violence is used interchangeably with intimate partner violence, but the two are not the same. Domestic violence includes intimate partner violence, but it also includes child abuse as well as elder abuse. Whereas intimate partner violence, as Ms. Daniels so aptly stated, includes any physical, psychological, sexual, or financial abuse, as well as stalking. And the more dangerous forms of intimate partner violence also include coercive control. And this happens between current or former intimate partners. And for those of you who may be asking, yes, this does include friends with benefits. So let's see what this may look like. Again, the video that I'm about to share with you may be somewhat triggering, but I want to encourage you that if it is bothersome, please, by all means, step away and feel comfortable to pace yourself.
Hey guys, welcome back to my vlog. I got flowers today. No, it's not my birthday or anything special like that. We had an argument last night and he said a lot of cruel things that really hurt my feelings, but I guess he's sorry because he got me these flowers today. I got flowers today. No, it's not our anniversary or any other special day. Last night he threw me into a wall. And choked me. And then beat me till I passed out. I woke up bloody and bruised all over. It was actually a nightmare. I guess he is sorry though, because I got these flowers today. I got flowers today. No, it's not Mother's Day or any other special day. Last night he beat me again and again and again. It was worse, much worse than any other day before. He wanted to sleep with me and I'm on my period, so I wasn't up for it. A couple of kicks, punches to the face, and he had his way. I got flowers today, and today is actually a very special day. It's the day of my funeral. Last night he beat me to death. If only I had the courage and the strength to leave him, maybe I wouldn't have gotten flowers today.
So as you might imagine, intimate partner violence is absolutely positively devastating. And as you can see in this video, and as with the stats that have already been shared with you, this is killing us. Every single year, 1,300 women are murdered by their intimate partner. And to help you really contextualize what that looks like, that's more women that are hurt in car accidents, more women who are diagnosed with cancer, and more women combined who are also hurt by non-intimate partners. Now, African-American women, believe it or not, have the second highest prevalence rates as it relates to intimate partner violence victimization. However, what you just heard by Ms. Daniels is that Black women experience the highest rates of IPV-related homicide. They are nearly 3 times more likely to be murdered than white women. The average age that Black women are murdered is 35 years old, which is 6 years younger than the national average. And the reason why is because we are less likely to leave and more likely to remain until peak lethality. So I asked the question, why are we not leaving? Oftentimes, the first person we're turning to are our family and friend networks. Unfortunately, they really are not trained to identify some of the danger points for intimate partner violence. And so they don't really know how to handle when we're coming and telling them what's going on with us. According to the Pew Research Center, Black women are the most religious population in our country. So we're more likely than any other population to turn to our religious leaders, to our ministerial teams, to our clergy. Unfortunately, most clergy are not trained within their seminaries about intimate partner violence victimization. In fact, when I last looked at this a couple of years ago, only one seminary covered intimate partner violence one day out of a 15-week semester in one class, and that one class was an optional class. Not only that, when we turn to the domestic violence service provision system, we're oftentimes experiencing and encounter racial discrimination. We unfortunately are all too often not valued, totally not heard, and really are not provided with the nature and level of support and concern that white women are oftentimes afforded. If we're going someplace, we're going to the hospital emergency room, but that too is a problem. It's a problem because unfortunately at this juncture, there is no routine way that has been adapted and adopted by all hospital systems to systematically and routinely screen a woman for intimate partner violence. Sad. Not only that, unfortunately, the last place that Black women are looking to turn to is the shelter system, because the shelters that we are oftentimes referred to are in under-resourced communities. The shelter itself is dilapidated, and the community is also distressed. So there are problems. And even as we just heard this morning with Lieutenant Nazaro, no one's really going to turn to the criminal justice system. The reason why, look at what's happening to all of our Black men and our Black women. Oftentimes routine traffic stops turn into someone losing their life. And so if you look at all of these factors are underpinning and also explaining the reason why we're not leaving our intimate partner. I've talked to women who have said to me, Bernadine, I would rather stay with the abuser that I know than leave and get abused by a system that I don't know. Bottom line is, we've got problems. Now, earlier in my presentation, I provided to you the perspective and the general framework for identifying intimate partner violence. But keep in mind that this definition is based on the abused person's perspective. And oftentimes in our community, we are oftentimes socialized to give our Black men a pass. We're defending and we're protecting our Black men at all costs. Unfortunately, sometimes and too often that cost has been with our life. And so we hear things and phrases from our family members and our friends to say, you know what, girl, he would never do that. Baby, that's a good man. Well, at least you got a man. Honey, he really didn't mean that. Or here's my favorite. A piece of man is better than no man at all. But that's too is a problem. Another issue is, and I ask you to finish this one statement, this one phrase that we oftentimes hear. What goes on in this house? If you said what goes on in this house stays in this house, then you have truly been socialized within the Black community. Because so often we have family secrets. And so family members may be well-meaning, but they're not going to necessarily get involved even within households that are a part of their extended family. They don't want to get involved because they believe that, you know what, it's not my business. But I'm here to tell you today, this is your business. And not acting on what it is that we're seeing and what it is our women are telling us and what it is women are sharing with us is causing more harm than anything else. And so I pose this question. Who's protecting whom? Our families are indoctrinated to protect the man from the man, so to speak. And we're also taught as Black women to fight back. But where does that leave us? Oftentimes that leaves us in a double jeopardy of sorts. And so are we going to get penalized and experience harsher sentences because we indeed fought back? Or are we going to remain with our partner and risk getting murdered and becoming one of those statistics? This leaves us in a bit of a quandary. But one thing is for certain is that this is truly costing us. IPV-related costs are costing the entire system of our country $8.3 billion every single year. This cost includes healthcare, it includes the domestic violence service provision system, as well as lost wages and time from work. I would also state that in order for a woman to safely leave, that it takes money and resources. We also know that Black women, by and large, are significantly underpaid. Equal pay date for all women this year was March 24th. Black women have to work an additional 3 months and several days in order to make the same amount as white women, an additional 7 months in totality to make as much as our white male counterparts. Over a lifetime, this compounds into $1 million. Either that, or Black women are forced to work an additional 10 years just to have the same amount of nest egg that our white male counterparts often enjoy. Now, I've shared with you some of the issues and the effects that underpin intimate partner violence, but now I really want to delve into some of the warning signs. And I've already seen some questions in the chat with people asking about warning signs. So you know what, sister girl, you may think you have Mr. Right. He wants all of you all the time. This man cannot let you out of his sight. Girl, he is so into you. He's so into you that everybody knows he's into you. He's checking your social media posts. He's liking your stuff. He's clocking you. He wants to know where you're going, how you're getting there, who you're going there with, and when you're coming back home. Initially, these behaviors may seem loving, but these are indicators of big problems that are just beneath the surface. And these are also indicators for dependency personality disorder. People, unfortunately, do not come with warning labels. So we really do have to observe and take note, and most importantly, take action. Intimate partner violence oftentimes begins with slights, insults, escalating into public shaming and blaming before it escalates into physical and sexual abuse. I would also challenge you to do something else. Before you start dating him, or even while you're dating him, check into this man's family history. Was his mother abused? If so, then he's 3 times more likely to replicate that same bad behavior with you. Did he experience any number of what we in the mental health profession call ACEs, or adverse childhood experiences? Meaning, were either of his parents murdered? Were either of his parents incarcerated? Are there unresolved issues with either of his parents? Are there mental health issues? Bipolar disorder, irritable type, is the more dangerous of the whim of mental health disorders, especially within the SPEMI format of mental health disorders. In addition to substance and chemical abuse and dependency, do you make more than he makes? Are you more educated than he is? How is he handling this? And how is this going to impact your relationship? So you're saying to me, you know what, Dr. Byrne, I've noted, this guy that I'm with, he is abusive. Now what do? I encourage you to connect with your local domestic violence provider. But before you do that, I want you to ask yourself some real critical questions and begin to make movements so that you are prepared with however it is you decide to proceed. First and foremost, Ladies, always, when I tell you always, 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 always have a separate bank account. I'm not saying don't share a bank account with your significant other. That's nice. And you need to also always have a separate bank account and make sure that you're saving your money. Them Louboutins look good, but if you're being abused, you really need to have some sort of money and resources to be able to actually safely leave. I would also encourage you to get a disposable phone. There needs to be a way that you can make the calls that you need to make and cannot be tracked. Disposable phones typically do not incur a phone bill. I also want to encourage you to know his routine. Every man has them, and then plan accordingly. If a man says that he's going to kill you, please, please take him seriously. And not only should you be taking him seriously, I want to encourage you to go and talk to someone who's going to take what you have to say seriously. And if you're in the audience and you're saying to me, you know what, Dr. Byrne, I'm not being abused, but I know someone who is, what can I do? What I'm about to share is something that we can all do. If you are a family member or a friend, if you see something, and chances are highly likely you will, because oftentimes perpetrators or abusers become more brazen with their behaviors and their actions. And so don't give him a pass for his bad behavior. Do not give him a pass. Don't see him mishandle your family member or friend and not say something about it. But even if nothing happens in front of you, if a woman tells you that she's being abused, believe her, support her, validate her experiences. Don't say things like he would never do that. And whatever you do, you want to always, always, always remain supportive. Sometimes it can be frustrating to try and push the person that you love to leave or to take action. Oftentimes women are not going to do things until they're ready. So in the meantime, do not get frustrated and recognize that it takes an exorbitant amount of courage to leave. In the meantime, what you can do is to make sure that you know what resources are available within your community so that when she is ready and she comes to you for assistance, you're there. If you're a member of clergy, I cannot articulate this enough. Rule number one is believe her. Prayer is good. The word of God says that faith without works is dead, right? But I would say with that, we've got to do a little bit more than just pray about the situation. And whatever you do, do not out her to her abuser. I don't care how good of an offering this brother is providing. I don't care that he's one of your top tithers within your congregation. A life is more valuable than money. Money you could always earn back. But once you lose a life, it can never be regained. I also want to encourage you to make sure you are also taking the time to know the providers within your community and then make the connection. Because what I do know for a fact, and research supports me, is that oftentimes our religious leaders are just not prepared to fully help and support the women. But they trust your word. And so if you say that a provider is someone who can be trusted, know that they trust your word and they're more than likely going to go with whatever it is you're encouraging them to do. And if I have religious leaders out there who are listening to me now, I'm going to tell you, like I tell my pastor when he's preaching a real good sermon, sir, you better say so. But I question, Domestic Violence Awareness Month is the exact same month as Breast Cancer Awareness Month. We see a multiplicity of churches who are elevating the survivors of breast cancer. And I am not by any means saying don't do that. But what I am saying is that you need to elevate domestic violence because it is within the walls of the sacred. 1 out of every 3 women you know has been experienced or exposed to intimate partner violence. And so it is a problem in our community, and not because our Black men are more dangerous, because Black women are less likely to leave. So I want to not only encourage you, but I want to challenge you to say so. Domestic violence, intimate partner violence in particular, is a problem. So, man of God, woman of God, you need to say so. Healthcare providers. Today's event is full of healthcare providers, burgeoning healthcare providers. There's a problem within the healthcare system, and a major one at that. The emergency system, healthcare system, that's where women, Black women in particular, of all of the former providers, we're more likely going to go to our emergency departments. Unfortunately, the healthcare providers are completely and totally botching this. I cannot tell you how many survivors I have talked to who have said to me, Dr. Byrne, the doctor didn't even ask if I was being abused. That's mess up number 1. Mess up number 2 is don't screen a woman when she's in the presence of her partner. More than likely, he was the one who inflicted those wounds and those injuries upon her. So I want to encourage you to separate the woman and ask her these critical questions by herself. And for those of you who are burgeoning healthcare professionals, I want to challenge you to develop a routine national screening. Just like we're screening for high blood pressure, just like we're screening for any of our other physical health symptoms and issues, we also need to be screening for intimate partner violence. On average, a year, a woman who's being physically abused is coming into an emergency department on average 7 times in 1 year. Let's be a part of the fix. If you're a manager and saying, you know what, Dr. Byrne, I'm not in the healthcare system, I'm none of that. But you know what? Your cost cutting could very well be helping to cut a Black woman's life short because you're not paying her. There's no pay equity. So I want you to keep this in mind as you're going through salary negotiations, as you're looking to figure out how am I going to give a pay increase and to whom? Understand that Black women deserve pay equity. If a woman has children, I want to encourage you to also make sure that there's flexibility within the scheduling. And by no means punish her for his bad behavior. Another common tactic of abusive men will take is he'll harass her at her job. And so he'll become a nuisance. I've heard of one too many survivors who have lost their jobs because the perpetrator, her abusive partner, was harassing her on the job. Unfortunately, we're not using the very resources that we have within our wheel well. What about security? Engage and more fully engage your company's security. Keep in mind that protecting him is hurting her and staying is hurting the children. It oftentimes takes at least 7 attempts for a woman to leave. And regardless of where you are, I want you to remember, sis, I got your back. Validate, encourage, support, pray, and fully support women. Lastly, I'm going to open the floor for questions. And I also want to make sure that I'm putting the DV helpline up here. And if you have questions, I'm also going to put my contact information up here. So I see that I have a few questions in the chat and I have 1 minute. So I'm going to stop sharing and I'm going to answer questions that have been posed to me in the chat. I am not going to name names because just for sake of safety, I don't know who's in the audience and whether or not I have an abused woman. So the question is, does epidemiology demonstrate the equal distribution of IPV among Black or brown women socioeconomically? I often find that the perception is that it's primarily among women from lower SESs. Anecdotally, they're asking my question, my response anecdotally as well as from research. And so both anecdotally as well as from research, oftentimes researchers take we take the easy way out. And the easy way out for researchers is to go to the population and get a convenience sample. Understand that survivors and women, and I'm saying women, although men are also abused as well, typically about 85% women and 15% men. It is across SESs. It has nothing to do with your socioeconomic state. So that's the short answer to your question. And then someone else asked, they have been in medicine for 20 years as a board certified emergency room doctor. There is no, yeah, no, you're absolutely right. There are no, there's no uniform way to do that. So I think we're done. Unfortunately, this is a rich webinar. Again, if you have questions, I am going to put my information. You can always contact me. You can find me on the web, and my web address is profbernadinew.com. You can find me on the World Wide Web. You could also follow me on Twitter, and my Twitter handle is profbernadinew. Thank you so much for your time. And I hope to see you again real soon.